All right. Good morning, everyone. Committee will come to order. Chair recognizes herself for an opening statement. Thank you to all my colleagues who are leading on the 19 bills we're marking up today. Sorry. That's from yesterday. Okay.
I have one.
Wait, I thought you wanted to say this first.
If it's
Okay. Committee comes to order. Chair calls up HR 501 and asks the clerk to report.
HR 501, a bill to amend the Controlled Substances Act to require registrants to decline to fill certain
Without
suspicious
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill?
Madam Chair, I have an amendment at the desk.
Clerk will report the amendment.
Can the gentlelady specify?
I don't have the number.
Amendment in the nature of a substitute to HR 501, offered by Ms. Harshbarger. Strike all the enacting clause and insert the following.
Without objection, the reading of the amendment is dispensed with. Gentlelady from Tennessee, Mrs. Harshberger, is recognized for 5 minutes in support of the amendment.
Thank you, Madam Chair. I want to thank you, Chair Rogers and Chairman Guthrie and Ranking Members Pallone and Eshoo for working with me and Representative Debbie Dingell to advance H.R. 501, the Block Report and Suspend Suspicious Shipments Act. Representative Dingell's been a welcome and valued partner on this bipartisan legislation. I know her district and state, like mine, has been ravaged by opioid and other drug overdoses and deaths. And I appreciate Representative Dingell working so hard in helping to lead this legislation in the past couple of Congresses. In my state of Tennessee, drug overdose deaths more than doubled in the last few years, totaling 3,814 lives lost in 2021. And in my East Tennessee district, we suffered 27 opioid overdose deaths per 100,000 population in the year 2020 compared to the national average of 21. But every story is a number, and every story is a person. And that's why breaking the opioid epidemic stranglehold on our nation is one of my foremost priorities, and I know is a bipartisan priority of this committee. In an effort to do so, my colleagues and I have introduced this legislation to combat drug diversion and pill dumping. H.R. 501 requires drug manufacturers, distributors, and other drug enforcement administration registrants to report and halt suspicious orders of controlled substances with requirements and guardrails needed to ensure these addictive and potentially dangerous drugs do not fall into the wrong hands. All stakeholders have important roles to play in preventing substance abuse disorders, and these common sense reforms will help save lives. I'm grateful for the committee staff working with me and Representative Dingell and relevant stakeholders to strengthen this bill and provide clarity to complement the work the DEA is doing in this area. The future of our nation depends on us solving the addiction crisis, and this bill is an important step towards the outcome. I urge all my colleagues to support this legislation and look forward to working with the Senate to enact it into law. And with that, I yield back.
Gentlelady yields back. Chair recognizes the lady from Michigan, Mrs. Dingell, for 5 minutes to speak on the amendment.
Madam Chair, I move to strike the last word to speak in support of the aims.
Ladies recognized for 5 minutes to strike the last word.
Thank you, Madam Chair, and I want to thank you and Ranking Member Pallone for including the Block Report and Suspend Suspicious Shipments Act in today's markup, and very much want to give my thanks to Rep. Harshbarger for joining me in this fight and being such a worthy partner. Pill dumping and other dodgy practices have perpetuated the opioid crisis, which continues to upend communities across the nation. I think this is one of the areas that we all agree in this committee it's a serious problem. That's why I've led the introduction of the Block Report and Suspend Suspicious Shipments Act, which advanced through this committee and passed on the House floor the past 2 Congresses. And I'm so proud to have to reintroduce this bill with Rep. Harshberger this year. The aims we're considering today includes input from a number of stakeholders, including the DEA, and is a strong step forward in addressing how opioids are distributed in our communities. With this legislation, we can better protect the American people by requiring drug manufacturers, distributors, and other DEA registrants to not only report, but also block or decline to fill suspicious orders. I urge all my colleagues to support this important legislation. It just maybe will get the United States Senate to do something this, I shouldn't say that, but it's early Friday. So thank you, Madam Chair, and I yield back.
Gentlelady yields back. Is there further discussion?
Hey, get ahead.
Seeing none, a vote occurs on the amendment. All those in favor shall signify by saying aye.
Aye.
All those opposed, nay. Ayes have it. The amendment is adopted. Is there further amendments? Question now occurs on approving H.R. 501 as amended. A recorded vote has been requested. The clerk will call the roll.
Rogers. Rogers votes aye. Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon. Hudson. Wahlberg. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Kamick. Obernolte. Obernolte votes aye. Pallone. Pallone votes aye. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Tonko. Clark. Cardenas. Cardenas votes aye. Ruiz. Peters. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Badagon. Blunt Rochester. Blunt Rochester votes aye. Soto. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Mr. Ruiz is not recorded. Ruiz votes aye. Griffith is not recorded. Griffith votes aye. Wahlberg is not recorded. Wahlberg votes aye. Hudson is not recorded. Hudson votes aye. Tonko is not recorded. Tonko votes aye. Kamick is not recorded. Kamick votes aye. Miller Meeks is not recorded. Miller Meeks votes aye. Pence is recorded as aye. Soto is not recorded. Soto votes aye. Madam Clerk, Madam Chair, on that vote, we have 44 ayes and 0 nays.
As forwarded by the Subcommittee on Health, and ask the clerk to report.
Committee print of H.R. 498 as forwarded by the Subcommittee on Health on March 8, 2023. To amend Title V of the Public Health
Without
Service.
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill?
Madam Chair,
For what purpose does the gentleman from California, Mr. Obernolte, seek recognition?
I move to strike the last word.
Gentleman's recognized for 5 minutes to strike the last word.
Thank you, Madam Chair. I am honored to speak in support of my bill, H.R. 498, the Lifeline Cybersecurity Responsibility Act. Colleagues, 130 people on average will die today in the United States because of suicide. The 988 Suicide Prevention Hotline plays a critical role in extending resources to people who are considering taking the incredibly sad step of taking their own lives. In December, however, the 988 hotline was interrupted by a cybersecurity attack on its systems operator. Unfortunately, that is something that not only probably cost lives in that case, but would cost lives any time that we have an interruption of that magnitude. This bill, the 988 Lifeline Cybersecurity Responsibility Act, would make meaningful steps to prevent them from occurring in the future by requiring internal coordination with Health and Human Services to protect the 988 hotline and similar lifelines from cybersecurity threats. I would like to thank my bipartisan co-lead on this, Congressman Cardenas from California, for his work on this issue and respectfully request your support for this bill. I yield back.
Gentleman from California, Mr. Cardenas, recognized for 5 minutes to speak on the bill.
Thank you, Madam Chairwoman. I move to strike the last word.
Gentleman's recognized for 5 minutes.
Yeah, thank you, Congressman Obernolte, for putting the emphasis on this important issue. And as you just articulated, we can do more and we must do more, and I'm glad that we are in a bipartisan way. I've spoken on this several times about the importance of 988 and building out the larger continuum of crisis care. We know that across the board, we're seeing unprecedented mental health struggles in our country. 50% of young adults reported anxiety and depression symptoms in 2023. I'll repeat, that is half of our young population. And these trends are continuing to be startling. It's a startling trajectory. A recent study shows that among adolescent girls, 30% have seriously considered attempting suicide. That's a 60% increase from 10 years ago. When suicide is the 12th leading cause of death overall in the United States and significantly higher in youth populations, the need for a robust crisis lifeline has never been more urgent. 988 provides that lifeline for individuals in mental health crisis. Through a network of over 200 local state crisis centers, which can provide immediate mental health support for overall chat or text, 988 can also connect those in need for more mental health resources. This mental health need is reflected in the uptick of 988 services since its launch in July of last year. Between January of last year and January of this year, calls answered increased by 57%. Chats answered increased by 264%. And texts answered increased by over 1,600%. While I've been excited to see an increase in the contact volume and improved response times, we still must do more to protect 988 from service interruptions. That's why I'm proud to partner with my colleague, Congressman Obernolte, to co-lead the 988 Lifeline Cybersecurity Responsibility Act, which would help to protect 988 from future interference. This common sense bill would simply create certain requirements to improve coordination and reporting on cybersecurity incidents and susceptibilities. That's a key step to defending the lifeline and ensuring continuity and services to individuals in crisis. Again, I want to thank Chairwoman Rogers and also Ranking Member Pallone for bringing this bill forward to this committee. And also, I'd like to take a point of personal privilege to say how much I missed the cameras over yesterday's afternoon and this morning, because we've been able to pass unanimously over a dozen bills in this committee, and yet nobody hears about it, nobody talks about it, but we in this committee know how bipartisan we work together and how much we complement each other's great work. Yet at the same time, I just hope that somebody out there knows that some good work is getting done in Congress in a bipartisan way. With that, Madam Chair, I yield back.
Hear, hear. Gentleman yields back. Is there further discussion? Seeing none, the question now occurs on approving H.R. 498 as amended. A recorded vote has been requested. The clerk will call the roll.
Rogers.
Aye.
Rogers votes aye. Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Bouchon. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone. Pallone votes aye. Eshoo. Eshoo votes aye. Deget. Deget votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Aye. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Cardenas. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Barragan. Blunt Rochester. Blunt Rochester votes aye. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye.
Johnson recorded?
Johnson is not recorded. Johnson votes aye.
Clerk will report.
Madam Chair, on that vote, we have 46 ayes and 0 nays.
The ayes have it, and the bill is adopted. Chair calls up H.R. 485 as forwarded by the Subcommittee on Health and asks the clerk to report.
Committee print of H.R. 485 as forwarded by the Subcommittee on Health on March 8, 2023. A bill to amend Title 11 of the Social Security Act to prohibit the use of quality-adjusted life
Without
years.
objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. I have an amendment at the desk for HR 485. Clerk will report.
Amendment to committee print of HR 485, offered by Ms. Rogers.
Without objection, clerk will, the reading of the amendment will be dispensed with. And I recognize myself for 5 minutes in support of the amendment. My amendment makes further changes after discussions with Ranking Member Pallone and takes into account technical assistance from CMS. Preventing discrimination against people with disabilities should be a nonpartisan issue, and I'm grateful for the work that we are taking on today to ban the use of further ban the use of quality-adjusted life years, or QALYs, and other discriminatory coverage measures that devalue the lives of people with disabilities in federal health programs like Medicare and Medicaid. Measurements like QALYs remove the patient and doctor from deciding what's best for the patient, simply to put cost without regards to the relative value that such a treatment or intervention may bring. What's worse is that QALYs discriminate against people with disabilities and seniors by discounting the value of a patient's life just because of the disabilities they may live with after the course of treatment. Every life has value and meaning, and we should not be letting the federal government and health insurers continue to devalue people like this. For example, if you have the disease like Duchenne's muscular dystrophy, your Medicaid plan won't be able to arbitrarily decide on your behalf or your doctor's behalf what the progression of the disease is, or that it may be too advanced and worth paying for treatments. Banning QALYs and other discriminatory measures in healthcare is not new and should not be controversial. Let's look at where support for banning QALYs comes from. The National Council on Disability, which is the federal government's non-government agency for disability, and it's recommended that Congress ban QALYs. Over 70 disability rights organizations for this bill support H.R. 485. And the first ever prohibitions on QALYs in Medicare were put into law by the Democrats in the Affordable Care Act, the ACA. The ACA wrote the following, quote, "The Secretary shall not utilize such an adjusted life year or such a similar measure as a threshold to determine coverage, reimbursement, or incentive programs under Medicare." H.R. 485 extends these specific policies to other federal care programs like Medicaid, makes clear that this prohibition cannot be waived by the Centers for Medicare and Medicaid Innovation, and that private plans that approve Medicaid or Medicare Advantage follow the same rules regarding the use of QALYs. I encourage all of my colleagues to vote yes on this bill today. Chair recognizes, and I yield back. The chair recognizes the ranking member, Mr. Pallone.
Thank you, Madam Chair. As the chair knows, I'm committed to working in a bipartisan way to hopefully achieve consensus on this legislation. However, unfortunately, we've not been able to reach agreement by today. It's disappointing as my staff and I have worked in good faith on the bill, but as I noted at the subcommittee markup, I need assurances that nothing in this legislation would go beyond banning the use of QALYs or could be used to delay or disrupt the implementation of drug price negotiation. As the chair stated at our health subcommittee markup, her intent with this bill was to prohibit the use of QALYs and other discriminatory measures in all federal programs, and she said it is possible for the government to evaluate the effectiveness of cures and treatments without devaluing the lives of seniors and people with disabilities. And that is a policy that I remain willing to support, as I don't believe it's acceptable to measure people's lives as more or less valuable than others. However, the amendment before us unfortunately has the potential, in my opinion, to go beyond this by inserting new ambiguity into the statute that could be interpreted to ban other non-discriminatory measures like the equal value of life year measure. And while I appreciate the majority has carried over the language we used in the Inflation Reduction Act, I fear in the context of this statutory provision, it could create uncertainty without further clarification, which is what my amendment provides. This language also represents a major expansion of the application of the language across all federal health programs, including Medicare Advantage and Medicaid managed care, as well as many programs outside our jurisdiction, such as the VA and TRICARE. So I think it's important that we get it right. Any drafting uncertainty is concerning given the implications for this policy. Cost-effectiveness research is an important tool to ensure that Big Pharma can't gouge the American people for drugs that don't provide clear improvements over the status quo. And I'm not supportive of efforts to widely ban cost-effective research, which is, I'm afraid, what this amendment, meaning the chair's amendment as drafted, could be interpreted to do and make this section ripe for potential litigation from Big Pharma. So I just want to be clear. I support the use of value measures like the equal value of life years measure that is designed specifically to address the concerns about QALYs from the disability community, but still provides a mechanism for determining the value of a drug for every person the same way. Many in the disability and patient communities do not have concerns with equal value of life years and support our efforts to ensure that this and other non-discriminatory measures can be used to lower pharmaceutical costs. And I will be entering into the record the statements of several patient organizations to this effect. So EVLYs, as I mentioned, are not discriminatory. And I'm concerned that the Republicans' late-breaking effort to ban them as well is a clear example of moving the goalposts. Based on the chairwoman's earlier comments, I believe that her intent was to ban the use of QALYs in federal health programs, and only recently have we learned that the intent may be to leave the door open to bar the use of EVLYs. And I'm concerned that without clear language, we'll also sweep in other measures that are objective and non-discriminatory. And ultimately, Big Pharma would prefer to have no metrics to help payers and our federal government make comparisons on the value of different drugs because they would prefer to be able to unilaterally set their list price as high as possible, regardless of whether the drug represents any improvement over therapeutic alternatives. So I just want to remind folks again of what is at stake here. And let me give a few examples of drugs used to treat serious conditions that can result in disability. According to the National MS Society, the median annual price of a brand-name drug used to treat MS was $94,000. For Duchenne muscular dystrophy, the list price was roughly $35,000 a year. Drugs to treat spinal muscular atrophy such as Spinraza and Zolgensma, I don't know if I'm pronouncing them right, can cost over $1 million a year. Due to these costs, these drugs are unavailable to many American families who do not have access or experience severe economic hardship in order to afford these drugs. And I just think it's wrong to say that the federal government should not be able to use any tools to evaluate how these drugs compare. So I plan to offer an amendment that I guess would be an amendment to your amendment, Madam Chair, that would make clear that EVLYs and other non-discriminatory measures can continue to be utilized by the federal government in order to protect patients from the unfair price gouging tactics of the pharmaceutical industry, while also banning the use of QALYs that I recognize are discriminatory. And I'm disappointed that we were unable to reach agreement on a consensus today, and that we're moving forward in a partisan manner. But I do believe the Republicans have moved the goalposts beyond the bill's initial intent, and I hope that we can work this out and come to a consensus that would not harm or potentially harm the implementation of the Inflation Reduction Act. And for that reason, I oppose the chair's amendment and the underlying bill unless my amendment as a secondary amendment ultimately passes, and I'll be offering that shortly, Madam Chair.
Gentleman yields back. Chair recognizes gentleman from Mr. Burgess.
I move strike last word,
Gentleman's recognized.
and I'll yield to the chairman.
Appreciate the gentleman yielding. I just would like to respond to some of the points that were made by the ranking member, and I appreciate all of the hard work that the ranking member and his staff have put into this bill to get it to where it is now. Since our first hearing on this bill, we've gone through a number of rounds of technical assistance, and we've resolved all of the concerns that the Centers for Medicare and Medicaid Services raised on the bill to help us make sure that it would be operable. But I have concerns about the amendment that the ranking member is bringing forward. Mr. Pallone's amendment would call out and declare a specific cost effectiveness tool. It's called the quality or the equal value life year gained, to be the non-discriminatory measure, regardless of the circumstance in which it is used. I don't know all the details of this tool as it was just raised on Monday, but I do know that there's some concerns with the measure. The National Council on Disability says, quote, while equal value life year gained eliminates the risk of undervaluing life extension for people with disabilities, it affords no value to quality of life improvements. The Disability Rights Education and Defense Fund says adding equal value life year gained is irrelevant to fixing the quality. It simply forces a trade-off between considering quality or undiscounted length of life when appropriate valuation should take both such measures into account. That's the Disabilities Rights Education and Defense Fund. The Partnership to Improve Patient Care, which includes Autism Society of America and the National Alliance of Mental Health, says failing to account for symptom and quality of life improvements ignores key aspects of value that are important to patients and important to different degrees for different patients. Maybe this measure, when paired with others in a specific circumstance, can be non-discriminatory, but I can't sit here today and with those concerns tell you that every scenario this measure is appropriate. At best, it seems like an imperfect metric. At worst, it will be a discriminatory metric. Either way, I do not support specifying that this is appropriate in the bill, because the bill only prohibits the usage of discriminatory measures. If this measure is truly not discriminatory in the circumstances in which it is used, H.R. 485 will allow it. If it is discriminatory, though, the measure shouldn't be used. The arguments being given about this measure, that it's necessary to implement the IRA, also raises questions. Current law says the Secretary shall not utilize such an adjusted life year or such a similar measure as a threshold to determine coverage, reimbursement, or incentive programs under Title 18, the Medicare title. Let's repeat that for just a second. Quote, shall not utilize such an adjusted life year or such a similar measure. Current law is clear. We shall not use adjusted life years, which are QALYs, in Medicare. It's also clear other similar discriminatory measures are not to be used either. If it's clear that current law says we shouldn't be using discriminatory measures in Medicare, how could this bill possibly be undermining the IRA, which impacts Medicare drug coverage? Some academics are writing that this metric is pivotal to the ability of Health and Human Services to negotiate drug prices and are trying to portray my bill as going too far. As we just showed, though, this is untrue because Medicare is already prohibiting the discriminatory practices in this manner, and my bill doesn't go any further than current law. I will be voting no on this amendment, and I encourage my colleagues, or on not on this amendment. I'll be voting yes on my amendment. I will be voting no on the ranking member's amendment, and I encourage my colleagues to do so as well. And I yield back the balance of my time. Is there further discussion? Thank you, and the gentleman yields back. For what purpose does lady from California seek recognition?
I move to strike the last word.
As she was recognized for 5 minutes, to strike the last word.
Thank you, Madam Chairwoman. At the heart of this bill and the amendment is the use of quality adjusted life years, which has been stated by whomever has spoken this morning on this legislation. And you all know that this is a cost effectiveness metric that inherently devalues the lives of people with a disability versus the lives of people without one. For more than 20 years, disability rights advocates have opposed the use of QALYs. And to address this concern, as has been stated, but it's worth restating, Democrats included a ban on QALYs in Medicare in the Affordable Care Act in 2010. Last year, Democrats further clarified that QALYs could not be used as part of Medicare's prescription drug price negotiations in the IRA. My staff and I have worked very hard to try and get to a bipartisan agreement on this bill that aims to extend the ban on Qualix to include Medicaid, the Children's Health Insurance Program, and Medicare's demonstration authority. Unfortunately, obviously, we didn't get there in time for today's markup. But I do think with a bit more time, we can do it. I support an extension of a Qualys ban to other federal programs, but what needs more discussion is whether the bill, as currently written, bans other types of effectiveness analysis, including analyses that consider whether a drug causes harmful side effects or whether a pediatric drug is valuable because it saves a child's life. So, Madam Chairwoman, I'd like to engage in a colloquy with you.
Okay.
Okay? I'd like to ask you to not take this bill up today so that we can continue our bipartisan work on it. It's just too important to let this, in my view, fall apart. Can we move the bill forward during the next committee, full committee markup?
Well, unfortunately, I believe it's important that we move the bill today. We have been working on this legislation. I'm committed to continuing to work to hammer out the specific language so that we ultimately will be able to pass this bill with bipartisan support. I recognize that the Democrats have included quality language in the ACA and in the Inflation Reduction Act. The language before us, I believe, is in alignment with that language. And in order to get this to the floor, I want to move it forward today.
Well, I look forward to working with you on in the manner that you just stated, that we will work toward a bipartisan agreement before getting to the floor.
Yes, you have. Thank you. You have my commitment to continue to work to get some agreed upon language.
Well, on that positive note, I'll yield back. Thank you.
Gentlelady yields back. Does anyone else seek recognition? For what purpose does the gentlelady seek recognition?
I move to strike the last word.
Lady, Ms. Schirkowski is recognized for 5 minutes to strike the last word.
I just want to chime in and saying I really do not think the piece of legislation that the Republicans have put before us is really ready for prime time. But on the other hand, I think what you've been hearing from the members on this side of the aisle is that we do believe that we can get there. I mean, I think there definitely are, at least for us, some unintended consequences that it will, among other things, hurt any kind of drug price negotiations, but we certainly, agree that we should get rid of Qualys. We just are very concerned that, as written, that this bill will prevent any kind of measures that will help protect people with disabilities and low income people. So I'm just echoing what I heard from the ranking member of the committee and Representative Eshoo, that why would we not continue with negotiations that are underway that can achieve a bipartisan agreement, do it now? I understand what you're saying is that we want to make sure that happens before we send it out of the full committee, but it seems to me that we ought to, right now, given the opportunity, to work together to negotiate. And with that, I yield back my time.
Gentlelady yields back. Further discussion? The vote occurs on,
Madam Chair, I think I have to
Okay.
move my amendment as an amendment to
Oh.
your amendment.
Oh,
Unless
okay.
I'm mistaken. Is that correct? Yes.
okay.
So I have a secondary amendment.
Oh, yeah, is there further,
Miss-
okay, so further amendments, right?
I believe I have, she can speak on mine. Yeah, I think I have to move it as a secondary amendment to yours. So I would,
Okay, gentleman's recognized for purposes of offering his amendment.
so I move to strike the last word and offer an amendment to the chair's amendment to HR 485.
Clerk will report.
Amendment to the committee print of H.R. 485, offered by Mr. Pallone, in lieu of the Section 2 proposed to be inserted by the amendment, insert the following new section. Section 2, prohibiting the use of quality-adjusted life years and similar measures in coverage and payment determinations under federal health care programs. In general, Section 1182E of the Social Security Act is amended by inserting "or treats extending the life of elderly, disabled, or
Oh, one second. Clerk will suspend without objection the further reading of the amendment. Gentleman's recognized in support of his amendment.
Thank you, Madam Chair. When this bill was before the Subcommittee on Health, I said that while I still had concerns about the language, I would agree to support the bill out of subcommittee so that we could continue to work on it to resolve our differences. And as I said earlier, we have been in good faith negotiations for the past 2 weeks, but ultimately we're not able to reach an agreement. So, Madam Chair, my amendment meets the goals I believe that you set for this legislation during the subcommittee markup, in that it would ban the use of QALYs across federal health programs while allowing the federal government to evaluate the effectiveness of treatments without devaluing the lives of seniors and individuals with disabilities. In fact, my amendment would make clear that measures that, I quote, value each year of extended life equally, irrespective of whether the individual is elderly, disabled, or terminally ill, would be permissible. So specifically, the amendment will allow federal health programs to use equal value life years to determine the value of drugs. EVLYs treat every year of life gained as the same, regardless of the person's disability. The National Council on Disability, an independent agency the chairwoman spoke of favorably, included EVLYs in its report on alternative measures to the QALY. Furthermore, numerous organizations have asked Congress to ensure Medicare and Medicaid can continue to use non-discriminatory measures like EVLYs to determine the value of drugs. So the amendment before us would be a significant victory, in my opinion, for the disability community. It would once and for all ensure that Medicare and Medicaid do not treat any life as less valuable than another. It would ensure that Medicare and Medicaid reward innovation and encourage the development of high-value drugs that can help extend the lives of all individuals while holding pharmaceutical companies accountable for high drug prices. And my amendment, I think, is a fair compromise that would accomplish the chairwoman's intent while addressing the concerns I expressed during the subcommittee markup. And Democrats, of course, as you can tell from the other members that spoke today, we stand willing to work with our Republican colleagues to help make this policy become law. So, Madam Chair, I know you're passionate about this issue. I know this bill would be a signature legislative accomplishment that has long been a priority for the disability community. But I do think that that my amendment would correct any problems and make the bill even stronger and more likely to pass and pass the Senate. So I urge my colleagues to support to adopt this amendment, and I yield back.
Gentleman yields back. Chair recognizes herself in opposition to the amendment. I've already outlined my concerns with the amendment, my ultimate opposition to this amendment, and I will yield back. Is there further discussion? We want to vote on my secondary. Okay. Okay. Chair, for what purpose does the gentlelady seek recognition?
Strike the last word.
Gentlelady is recognized for 5 minutes to strike the last word.
I wanted to strongly support the ranking member's amendment. This moves us in the right direction, absolutely. It seems to me that, what it does is allow for non-discriminatory action, and I think it does embody still what the efforts that we want to achieve. And so I just think that, as we move toward getting the right bill, because I think we share many of the goals, that we pass this amendment. And with that, I yield back.
Gentlelady yields back. For what purpose does the gentlelady seek recognition?
Madam Chair, I move to strike the last word to speak in support of the Pallone Amendment.
Mrs. Dingell is recognized for 5 minutes.
Thank you, Madam Chair. First of all, I want to recognize you for all of your work, and I know how much you care about this issue as well. But as co-chair of the Disability Caucus, handpicked by Jim Langevin, and co-chair of the Senior Caucus with my colleague behind me, I can't not speak. We know that no one should be made to feel less valued due to their disability. Quality-adjusted life years are known discriminatory metrics that devalue the lives of aging Americans and those living with disabilities. And that's why I think everybody here is supportive of the original intent of this bill, to ban QALYs in all federal programs. However, I think I'm disappointed that we can't come to an agreement on the underlying bill to prevent the use of these discriminatory metrics while simultaneously protecting the use of very clear and well-defined tools to keep the cost of drugs low. We do not believe other non-discriminatory measures should be banned, and unfortunately, the Republican amendment it doesn't provide the certainty that's needed on that. We have a responsibility to protect Americans from exorbitant drug prices that are actively harming communities across the nation, and it's really critical that we do it in a way that is clear and precise. I know and I appreciate that the Republican amendment uses language that we support that was in the IRA, but the amendment inserts this language into a new part of the statute that creates ambiguities for its meaning unless it's further clarified. So that's why I would urge all of my colleagues to support the Pallone Amendment instead. With this amendment, we can ban the use of QALYs, which I think we all do, while preserving critical tools to protect all Americans from the harms of high drug prices, which too often falls discriminately onto people with disabilities, chronic illnesses, and terminal illnesses. I know everybody in this room cares deeply about Americans with disabilities, and it's my hope this committee can continue to work to identify ways to positively impact the lives of all Americans. I urge my colleagues to support the Pallone Amendment, and I yield back.
Gentlelady yields back. Chairman recognizes the member from Texas.
Move to strike the last word.
Gentleman's recognized for 5 minutes
And
to
I'll
strike
yield
the
to
last
the
word.
chairwoman.
Thank you. I appreciate the gentleman yielding. For the members, I just want to clarify that this is the first time that a specific metric would be inserted into statute. And that is what is of grave concern to me. And this is, we've never specified a specific metric in statute before, whether it was the ACA or the IRA. And at best, it seems like an imperfect metric. At worst, it could be a discriminatory metric. So either way, I do not support specifying a specific metric into the bill. I do not believe it is appropriate, and because the bill only prohibits the usage of discriminatory measures, if the measure is truly not discriminatory, in this circumstance, H.R. 485, the underlying bill, would allow it. So I am concerned about the potential of this being a discriminatory metric. I am committed to continuing to work with the Democrats to hammer out the language, but I do oppose. So this is inserting the metric is called the every life year adjusted, the equal value life year. This is a specific metric that is being proposed to be added through the ranking member's amendment, and I oppose adding a specific metric. It would be the first time that it's done. And as I stated, disability groups have concerns. The National Council on Disability says that while the equal value life year metric eliminates the risk of undervaluing life extension for people with disabilities. It affords no value to quality of life improvements. And I stated what other disability groups have stated as far as having concerns with this specific metric. I will yield back to the gentleman.
Mr., could I ask the doctor to yield
Yes.
to me with the time you, or some of the time you have remaining?
I'm thinking it over.
I know we're not at rules, so it's okay.
I'll be happy to yield to the
Thank you. I just wanted to say, again, I don't know how much we want to keep belaboring this, but I did want to say my amendment doesn't specifically say that EVLYs as a metric are included. But what it says is, and I quote, that the value of each year of extended life equally, irrespective of whether the individual is elderly, disabled, or terminally ill, would be permissible. I know you would probably say that that's allowing the EVLYs, or specifically mentioning the EVLYs, but I don't see it that way. But I don't want to keep arguing. I think the points are being made here, and we can move on. Thank you.
You know, for once, I agree with the gentleman. I don't want to keep arguing either, so I'll yield back to Tom.
Okay. Gentleman yields back. Vote occurs on the ranking member's amendment. All those in favor say aye.
Aye.
Those opposed, nay. Nays have it. Gentleman has requested a recorded vote. Clerk will call the roll.
Rogers.
No.
Rogers votes no. Burgess. Burgess votes no. Latta. Guthrie. Guthrie votes no. Griffith. Griffith votes no. Bilirakis. Bilirakis votes no. Johnson. Johnson votes no. Bouchon. Hudson. Hudson votes no. Wahlberg. Wahlberg votes no. Carter. Carter votes no. Duncan. Duncan votes no. Palmer. Dunn. Dunn votes no. Curtis. Curtis votes no. Lesko. Lesko votes no. Pence. Pence votes no. Crenshaw. Crenshaw votes no. Joyce. Joyce votes no. Armstrong. Armstrong votes no. Weber. Allen. Allen votes no. Balderson. Balderson votes no. Fulcher. Fulcher votes no. Pfluger. Pfluger votes no. Harshbarger. Harshbarger votes no. Miller Meeks. Miller Meeks votes no. Kamick. Kamick votes no. Obernolte. Obernolte votes no. Pallone. Pallone votes aye. Eshu. Eshu votes aye. Deget. Oh, sorry. Abstain. Abstain. Deget votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Badagon. Badagon votes aye. Blunt Rochester. Blunt Rochester votes aye. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Reb Weber is not recorded. Weber votes no. Latta votes no. All of these should be over here. Is someone listed as present? Present. Okay.
How is Rep. Eshu recorded?
Rep. Eshu is recorded as present.
Clerk will report.
Madam Chair, on that vote, we have 21 ayes, 27 nays, and 1 present.
The amendment is not agreed to. Okay, the vote now occurs on approving. On the Rogers amendment, all those in favor say aye. Those opposed, nay. No. The ayes have it. The amendment is agreed to. Question now occurs on approving HR 485 as amended. A recorded vote has been requested. The clerk will call the roll.
Rogers.
Aye.
Rogers votes aye. Burgess. Burgess votes aye. Latta. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Fluger. Fluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Obernolte. Obernolte votes aye. Pallone.
No.
Pallone votes no. Eschew. Eschew votes present. Deget. Deget votes no. Schakowsky. Schakowsky votes no. Matsui. Matsui votes no. Castor. Castor votes no. Sarbanes. Sarbanes votes no. Tonko.
No.
Tonko votes no. Clark. Clark votes no. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Peters. Peters votes no. Dingell. Dingell votes no. Veazey. Veazey votes no. Custer. Custer votes no. Kelly. Badagon. Badagon votes no. Blunt Rochester. Soto. Soto votes no. Craig. Craig votes no. Schreier. Schreier votes no. Trahan. Trahan votes no. Fletcher. Fletcher votes no.
Any member seeking to be recorded? Madam Clerk, how is Latta recorded?
Latta is not recorded. Latta votes aye.
How is Kamick recorded?
Kamick is not recorded. Kamick votes aye.
Madam Clerk, is Fluger recorded?
Fluger. Fluger is recorded as aye. Weber is not recorded. Weber votes aye.
Clerk will report.
Madam Chair, on that vote, we have 27 ayes, 20 nays, and 1 present.
The ayes have it. The bill is adopted. Passed. Chair calls up HR 467 as forwarded by the Subcommittee on Health and asks the clerk to report.
Committee print of HR 467 as favorably forwarded by the Subcommittee on Health on March 8, 2023.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? Gentleman from Ohio, for what purpose? Do you seek recognition?
Madam Chair, I strike the last word.
Gentleman's recognized for 5 minutes to strike the last word.
Thank you, Madam Chair. Today, we're making progress in the effort to curb the deadly fentanyl crisis, which has claimed thousands of American lives. After years of trying to permanently schedule fentanyl-related substances, Schedule I narcotic, and over a year of working with my good friend, the gentleman from Virginia's 9th District, I'm pleased that this committee is poised to approve H.R. 467, the Halt Fentanyl Act. While I'm glad that we are finally able to move forward on this bill, it should not have taken us this long to reach this point. Permanently scheduling fentanyl-related substances should not be a political issue. Serving, protecting, and ensuring the safety of our communities is the reason we are all here in Congress. And working to eradicate the scourge of fentanyl in order to save lives should be one of our top priorities. I'd like to note that there are a few misconceptions about this bill, and I'd like to take some time to clear them up. First, if you lay fentanyl-related substances into an illicit narcotic, you should be held accountable regardless of mandatory minimums. There's no saying, if you can't do the time, don't do the crime, and this crime is murder. Second, there have been charges made against this bill. It would restrict all research and studies of fentanyl and fentanyl-related substances for medicinal benefits. This is simply not true. The Halt Fentanyl Act specifically includes a carve-out that enables researchers to continue studying Schedule I substances for the purposes of identifying potential medical benefits. And here's the truth about fentanyl. It's killing on average 175 people a day and is now the #1 killer for Americans in the 18 to 45 age range. Fentanyl and fentanyl-related substances have claimed over 64,000 lives between April 2020 to April 21, and we know that in the last numbers, we're looking at over 70,000 in a year. Even more shocking is how incredibly cheap it is to manufacture illicit drugs laced with fentanyl. For just 10 cents a dime, drug cartels can manufacture one fentanyl-laced prescription pill that will kill one American. It's heartbreaking to meet the families who have lost a son or a daughter to this poison. It's also disheartening to have to explain why Congress hasn't yet permanently scheduled fentanyl-related substances as Schedule I narcotic. Statistically speaking, since this market began, at least 5 to 10 Americans have died. There is a reason why the Drug Enforcement Administration lists scheduling fentanyl-related substances Schedule I narcotics as their #1 priority. For these reasons, I'm glad we have the Halt Fentanyl Act before us today. I ask unanimous consent, Madam Chair, to record the following letters from the National Association of Assistant United States Attorneys and Victims of Illicit Drugs in support of Halt Fentanyl Act.
Without objection, so
Thank you, Madam Chair. I ask my colleagues to support this important piece of legislation to put an end to this deadly fentanyl crisis. Madam Chair, I yield back the balance of my time.
Gentleman yields back. Further discussion? For what purpose does the gentleman seek recognition?
Madam Chair, I move to strike the last word, please.
Mr. Tonko is recognized for 5 minutes.
Thank you. This is a loss many of us know too well. The loss of a daughter, a son, a father, mother, sister, or brother, a neighbor dying much too young and leaving behind a grieving family. Communities being ripped apart by poison seemingly beyond our control. Over the last decade, I've focused my advocacy in Congress on knocking out every single barrier possible to addiction treatment so that when individuals struggling with the disease of addiction reach out for help, we have a medical system ready to welcome them with open arms. As co-chair of the Addiction Treatment and Recovery Caucus, which is bipartisan, and the author of the Mainstreaming Addiction Treatment Act, which is now law, I'm deeply committed to having serious conversations about what we can do to take action to save lives. A critical piece of this that I think we all agree upon is that we need better access to treatment. To every member in this room who cares about this issue, I invite you to meet with me, meet with the caucus, and let's work together to address these issues. The recent passage of the MAT Act, the Mainstreaming Addiction Treatment Act, has dramatically expanded the U.S. healthcare system's ability to treat opioid use disorder with buprenorphine, increasing the number of medical professionals who indeed can prescribe buprenorphine for opioid use disorder from 130,000 individuals to 1.8 million with the removal of the X waiver. I want to thank the many members of this committee who worked across the aisle to make that reality. And while the legislative fight on MAT is over, the battle to make treatment on demand a reality and to save lives is still well underway. Medication-assisted treatment for addiction significantly reduces the risk of overdose death. However, despite the effectiveness, approximately 87% of individuals with opioid use disorder who may benefit from life-saving medication-assisted treatment simply do not receive it. And while the MAT Act is a huge leap forward, we have more work to do. Despite progress in eliminating this barrier to prescribing buprenorphine for opioid use disorder, prescribers and patients across the country are reporting difficulty getting buprenorphine prescriptions filled. The lack of clear guidance to pharmacies, manufacturers, and distributors from the DEA has contributed to this gap in access for patients in need of buprenorphine. A survey on pharmacy access published by the American Society of Addiction Medicine found that commonly cited reasons for pharmacists for not filling buprenorphine prescriptions included a supplier shortage of the medication, the pharmacy's wholesale supplier limiting the amount of the medication that the pharmacy may order or stock, and corporate policies restricting the dispensing of the medication, and a belief that the DEA has a cap on the quantity of buprenorphine that can be disposed. We absolutely need to reduce the stigma, clarify any uncertainty, and make it clear to all involved that DEA wants people to have access to addiction medication. I also hope that this Congress would pass the Bipartisan Reentry Act, which would be a game changer for reducing overdose deaths and suicides by allowing all states to provide pre-release care to Medicaid-eligible individuals up to 30 days prior to release from incarceration. Individuals reentering society after incarceration are some 129 times more likely to die of a drug overdose in the first 2 weeks after release versus the general population. The major county sheriffs of America, the National Sheriff's Association, and the American Jail Association all agree that this is good policy that would save lives. So I invite everyone here today to join me in championing this effort to save lives in our communities. Let me close by saying this must not be about politics, so that together we can improve access to treatment, and I humbly ask, let's continue to work on this hand in hand. With that, Madam Chair, I yield back.
Gentleman yields back. Does anyone else seek recognition? Any further discussion? For what purpose does the gentleman seek recognition? From Georgia, Mr. Allen.
Madam Chair, I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. In 2021, life expectancy in the United States sadly dropped to its lowest level in 2 decades. This was largely driven by the spread of illicit opiate drugs, which killed more than 80,000 Americans and more than 1,700 Georgians last year. Due to the Biden administration's disastrous handling of the southern border, fentanyl poisoning has emerged as a leading cause of death for Americans aged 18 through to 45. We're living through an undeniable public health crisis that will not end until policymakers implement strong policies to stop the overdose epidemic. That is why I am a proud original co-sponsor of the Halt Fentanyl Act, authored by Congressman Griffin and Alada, to permanently place fentanyl-related substances into Schedule I of the Controlled Substances Act. The United States Drug Enforcement Agency has said that permanently scheduling fentanyl-related substances is their top legislative priority, and this legislation will do exactly that. The Halt Fentanyl Act will stop the creation of new fentanyl-related substances, which is a crucial first step to curbing the illicit fentanyl crisis. I urge all my colleagues to vote in favor of this bill. Thank you, Madam Chair, and I yield back.
Gentleman yields back. For what purpose? Ranking members recognized for 5 minutes to strike the last word.
Thank you, Madam Chair, and I'll try to be brief because I know we're trying to get through here with the votes. But I just want to say I continue to have significant concerns with the Halt Fentanyl Act, and I am discouraged because I do think that we have some amendments that, if adopted, would have made this bill acceptable to Democrats. The bill, as amended by the majority, now expands mandatory minimums associated with FRSs and still excludes the critical guardrails proposed by the Biden administration. And this bill doubles down on criminalization first policies and does nothing in my opinion, to get our country out of the opioid crisis. Moreover, as I stated in the subcommittee markup, FRSs have already been scheduled continuously for the past 4 years, and yet there has not been any appreciable reduction in overdoses. In fact, during the health subcommittee markup, several of my Republican colleagues acknowledged that it's true that this bill in and of itself will not stop the fentanyl crisis. But anyway, I just want to say I am going to, just to shorten this, I intend to offer an amendment, and so I'll talk more about it, that will substitute the whole Fentanyl Act with the SAFE Act, which is a bipartisan bill that comprehensively addresses fentanyl-related substances. And I do really think we have to turn to real bipartisan solutions to address addiction, misuse, and overdose deaths. Otherwise, this is not going to, ultimately pass the Senate or be signed by the president. But I'll yield back at this time.
Gentleman yields back. Does anyone else seek recognition? Mr. Griffiths recognized for 5 minutes to strike the last word.
Am I speaking? Is there an amendment, Madam Chair? Point of order. There is no amendment?
Not
Okay.
yet.
Then, Madam Chair, I appreciate it, and I agree with everything that my colleague of Ohio, Mr. Latta, said. Mutatis, with one exception, mandatory minimums. It's a completely separate issue. This bill makes analogs the same as fentanyl. That's what triggers the mandatory minimums. I understand the arguments against mandatory minimums, and I think that's a rational debate for people to have. But I will tell you, that debate belongs on another bill, and it belongs in a different committee. And so I hope that we will pass this bill, and as I said in the subcommittee, let's make it harder on the bad guys. I yield back. I yield to my friend from Pennsylvania, Mr. Joyce.
Thank you for yielding. I do want to briefly address some of the topics that we've been discussing. First, to those who are worried about mandatory minimum sentencing guidelines, I would point back to the testimony that Dr. Westlake presented in front of this committee just a few months ago. He said that if he could choose one drug to have mandatory minimums attached to it, it would be for those trafficking in illicit fentanyl-related substances. Federal prosecutors focus efforts on dismantling drug trafficking networks who are actively profiting off of the deaths of American citizens. I hear it consistently when I'm at home from sheriffs and law enforcement agents in all 12 counties that I represent in Pennsylvania. And earlier this year, we were able to hear the devastating testimony from two of my constituents, Ray and Deb Collin, who tragically lost their son to fentanyl poisoning. Their loss, and those who have felt this across our nation and are feeling it today, underscores how critical it is that we permanently schedule fentanyl-related substances class-wide. I urge all of my colleagues to support this bill, and I yield back to the gentleman.
And I yield back to the chair.
Gentleman yields back. At this time, we're going to recess for votes, and we will return immediately following the last vote. Committee stands at recess. debate on HR 467. Does anyone seek to be recognized on the bill? 467. This is the Holt fentanyl.
Oh, we're still working on it.
Yes.
Oh, I have the amendment.
Okay. Anyone see? Okay, well, ranking member is recognized for the purpose of offering an amendment. The clerk will report the amendment.
Amendment to the committee print of HR 467, the Halt Fentanyl Act, offered by Mr. Pallone. Strike sections 2, 3, 4, 5, and 6, and insert the following.
Without objection, clerk will dispense with the reading. So ordered. Mr. Pallone is recognized for 5 minutes in support of his amendment.
Thank you, Madam Chair. I'm once again offering the SAFE Act, a bipartisan proposal that takes the Biden administration's comprehensive approach in addressing fentanyl-related substances as an alternative to the bill before us today. I would ask my Republican colleagues to work with us and consider the SAFE Act because I do view the guardrails in the administration's proposal as necessary, particularly if we're going to pass something that not only passes the House, but the Senate and gets signed by the President. Now, let me mention 3 things I'll try to summarize because I know we all want to get out of here. First of all, this includes the off-ramp provision, and the off-ramp provision, and these are general, I'm being general here because of the time, it basically allows for ability to schedule or reschedule FSRs that are less, that are less risky. Well, I'm not sure now. We're talking about the minimum sentences here? Or? Oh, yeah, this is the off-ramp provision. The concern is that we run the risk of preemptively scheduling an entire class of substances in the most restrictive schedule without the ability to conduct a thorough, expedited review of a substance's pharmacological effect on therapeutic potential. So basically, this allows us to schedule or reschedule things that are less risky or maybe even harmless, which is not the case now with the bill. And without that provision, that would allow individuals to seek a reduced or vacated sentence for an off-ramp substance. In other words, one subsequently found to have a lower risk profile. If you don't do that, you run the risk of keeping people unjustly incarcerated. The second thing is this goes to the mandatory minimums. Exempt in the FRSs from mandatory minimums unless they lead to serious bodily injury or harm. And then the third thing says that allows the ability to reduce the sentence if it's found to be, no less risky or later after a person was already sentenced. So without these kind of reforms, the concern is that, we're just going to criminalize everything. There's going to be mandatory minimums for everything. And, we're not approaching this, in my opinion, from a public health crisis perspective. We're just saying minimum sentences and that's it. And I don't think that's ever worked, and I don't think it's going to work this time. And that's why the administration is putting in these guardrails to make it possible, depending on whether we find out that, something is less risky or harmless or that a sentence that was mandatory shouldn't have been imposed, that we can go back and review that again without having just the, total mandatory minimums across the board. Again, I honestly strongly believe that these guardrails should be put in, but I also know that the President and the Senate aren't going to take it up unless we have something like this in the bill. So again, I would urge my colleagues to support these changes, in part because I think they're a good public policy, but also because I think if we do want to get the law passed, it would be necessary to do something like this to achieve the Senate and the President's support. And with that, I would yield.
Gentleman yields back. Further discussion on the amendment.
Madam Chair?
For gentleman is recognized to strike the last word. Mr. Griffith, for 5 minutes.
Speaking to the amendment, Madam Chair, I appreciate it, but I would remind the committee and the gentleman that we're not criminalizing everything. What we're criminalizing is a chemical compound which has the same effect as fentanyl in the ones that we've studied and that we know of. There's an off-ramp for those if they find one later that does something different. But what we found was the bad guys, until we had temporary scheduling of the analogs, they would use this as a way to get around the law. So all we're doing is criminalizing fentanyl analogs. That's all this bill does. Doesn't criminalize everything. It doesn't say that mandatory minimums are the way to go on everything. It doesn't say that we're doing this across the board. It says only on those substances where bad guys have come in and they've rearranged the molecule just enough to make an argument to the courts that it's not an illegal substance. Well, it should be an illegal substance. That's all this bill does. And as I said previously, if one wants to talk about mandatory minimums, that's a rational discussion for our nation to have and for as policymakers for people to have. I'm not saying it's not. What I am saying is this is not the bill. This is not the day. This is not the time. This is not the place. And in fairness, this is not the committee. That is a jurisdiction of the Judiciary Committee. Now, I get it, and I don't know what the president will do or not do on this bill. I don't know what the Senate will do or not do on this bill. I will tell you when they get it, they may do things that the gentleman who's offered the amendment might agree to, or they may not. I will tell you that Jefferson in the Manual of Parliamentary Practice and Procedure actually said we shouldn't discuss what the Senate might do because we have an independent decision to make. This committee needs to decide, do we think permanent scheduling of analogs will help in a small way on the problem with overdoses and poisoning by fentanyl? I think the answer to that is yes. Do we think this will deter bad guys? I think the answer to that is yes. This is one of the major priorities of the president's Drug Enforcement Agency, because they've seen with temporary scheduling that they stopped trying to get around it, and it made it easier for them to deal with fentanyl. But if you want to make it easier for the bad guys, vote for this amendment and vote no on the bill. I yield back.
Gentleman yields back. Further discussion on the amendment? Gentleman from North Dakota, Mr. Armstrong's recognized for 5 minutes.
Thank you, Madam Chair. And I just want to reiterate what my friend from Virginia said. Fentanyl is a poison. And of all the drugs in the Schedule I, it's the one that's killing the most people. I don't know how many Republicans there are that want to have a bigger, broader conversation about minimum mandatory sentencing as it goes across the entire criminal justice system, but I'm one of them. I did it in North Dakota. I've worked with just about every single one of your colleagues on the Judiciary Committee, and we can have a long and thoughtful conversation about the entire weight of a drug conspiracy coming onto somebody who's doing low-level addict dealing. We can talk about enhancements for firearms. We can talk about all of those different things. But you cannot take the most dangerous drug we are dealing with as a society and exclude it from minimum mandatory sentencing. We can have conversations about all of the Schedule I's. And to be frank, I hope getting anything from a fentanyl analog or otherwise out of Schedule I is really, really hard. I hope the only way you can do it is if it is legitimately, I'm sitting next to a doctor who is significantly smarter about this stuff than I am, that it's legitimately the only substance on earth that can help you with whatever medical ailment you have, because the risks are simply too high. So we can talk, and I will work with anybody and everybody on the Judiciary Committee, on the Energy and Commerce Committee, on the Space Science and Tech Committee. It could be the Ag Committee. We could deal with hemp and marijuana and all of those different issues. I'll work with anybody if we're going to talk about smart, serious criminal justice reform. But fentanyl analogs have to be illegal. They have to be illegal, because otherwise you will see this occur in a different way and in a different place. So I think this bill is appropriate. I think having these conversations about those other things are also appropriate. I think we're mixing and matching two different things right now, and it's a really dangerous road to go down. And with that, I would yield to my friend from Utah.
Thank you. I I wish there was a way that the gentleman in the audience could express his story.
We do.
And I just want to let you know I've been watching you, and I want you to know I understand your story. You don't need to use words, and I just appreciate you being here and wish you the best. I yield my time.
Would the gentleman yield? Would the gentleman yield?
Yes.
Yeah, if I could just reiterate one point. When we had our the DEA in here, and my friend from Virginia brought this up, the number one issue that the DEA is looking at in this Congress is getting this bill passed. They need it, and let's get it to them. Thank you. I yield back to my friend.
And before I yield to my friend from Pennsylvania, I think that's the important part of this. This isn't a matter about a minimum mandatory or not. This is just applying fentanyl minimum mandatories to all substances substantially similar to fentanyl. The problem is without this legislation, they're not illegal.
Would
So
the gentleman
with that, I
yield?
yield to my friend from.
I want to put an exclamation point on what the gentleman from Ohio just said, reminding each of us that in front of this committee, the DEA has said that permanently scheduling fentanyl-related substances is their top legislative priority. We can't afford to wait any longer. And I want to associate with the gentleman who's here holding the picture of a loved one who obviously has passed away from fentanyl poisoning. And I yield back.
Mr. Armstrong controls the time.
Now I yield to my friend from Georgia.
Thank you. I thank the gentleman for yielding. I just want to encourage everyone on both sides of the aisle, let's stay focused. Folks, I served for 10 years in the Georgia State Legislature, and as one of the only pharmacists in the legislature, I was always responsible for the dangerous drug bill that we passed every year. And all we could do was identify the analogs from the previous year. And all they could do was just to simply change them for the next year. And it was on and on and on, just like a cat chasing his tail. We could never catch them. This finally does that. When we identify all fentanyl analogs and we make them illegal, then we are accomplishing something. Please, if you must vote for the amendment or against the amendment, vote for the final bill. We need this. People are dying because of this. Thank you, and I'll yield back.
Thank you, and I yield back.
Gentleman yields back. Further discussion on the amendment. Lady from Michigan, Mrs. Dingell, is recognized for 5 minutes on the amendment.
Thank you, Ms. Dingell. Just 10 seconds. I just want to stress that, with the underlying bill, and this is not changed in my amendment because this is part of the administration's policy that we would permanently schedule FRSs. It's just the question of guardrails along the lines of what I discussed in terms of, the ability to look at a number of these things over time and make sure that we're not scheduling things that are less risky or harmless, or we're not, putting those items into a situation where there's a mandatory sentence. But the underlying bill and the amendment doesn't change it, and the administration do support permanently scheduling the FRSs. I yield back.
Gentleman yields back. Further discussion on the amendment? Seeing none, the vote occurs. And a recorded vote has been requested. This is on the Pallone amendment. Clerk will call the roll.
Rogers.
No.
Rogers votes no. Burgess. Burgess votes no. Latta. Latta votes no. Guthrie. Guthrie votes no. Griffith. Griffith votes no. Bilirakis. Bilirakis votes no. Johnson. Johnson votes no. Bouchon. Hudson. Wahlberg. Wahlberg votes no. Carter. Carter votes no. Duncan. Duncan votes no. Palmer. Dunn. Dunn votes no. Curtis. Curtis votes no. Lesko. Lesko votes no. Pence. Crenshaw. Crenshaw votes no. Joyce. Joyce votes no. Armstrong. Armstrong votes no. Weber. Weber votes no. Allen. Allen votes no. Balderson. Balderson votes no. Fulcher. Fulcher votes no. Pfluger. Harshbarger. Harshbarger votes no. Miller Meeks. Miller Meeks votes no. Kamick. Kamick votes no. Obernolte. Obernolte votes no. Pallone. Pallone votes aye. Eshu. Eshu votes aye. Deget. Deget votes aye. Schakowsky. Matsui. Matsui votes aye. Castor. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Ruiz. Peters. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Kelly. Custer votes aye. Kelly. Badagon. Badagon votes aye. Blunt Rochester. Blunt Rochester votes aye. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Peters is not recorded. Peters votes aye. Ruiz is not recorded. Ruiz votes aye. Schakowsky is not recorded. Okay. Schakowsky votes aye.
Clerk will call the roll, or clerk will report.
Madam Chair, on that vote, we have 20 ayes and 24 nays.
The nays have it. The amendment is not agreed to. Are there any additional amendments? Seeing none, the question now occurs on the approving H.R. 467 as amended. A recorded vote has been requested. The clerk will call the roll.
Rogers.
Aye.
Rogers votes aye. Burgess. Burgess votes aye. Latta.
Aye.
Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon. Hudson. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Fluger. Fluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone. Pallone votes no. Eshu. Eshu votes no. Deget. Deget votes no. Schakowsky. Schakowsky votes no. Matsui. Matsui votes no. Castor. Sarbanes.
No.
Sarbanes votes no. Tonko.
No.
Tonko votes no. Clark.
No.
Clark votes no. Cardenas. Ruiz. Ruiz votes no. Peters. Peters votes no. Dingell. Dingell votes no. Veazey. Veazey votes no. Custer. Custer votes no. Kelly. Badagon. Badagon votes no. Blunt Rochester. While Rochester votes no. Soto. Soto votes no. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes no. Fletcher. Fletcher votes no. Cardenas votes no. Madam Chair, on that vote, we have 27 ayes and 19 nays.
Clerk calls up HR 801 and asks the clerk to report.
HR 801, a bill to amend Title III of the Public Health Service.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill? For what purpose does the gentlelady from Arizona seek to be recognized?
Madam Chair, I move to speak on the bill.
Ms. Lesko is recognized for 5 minutes.
Thank you. I'm proud to co-sponsor HR 801, the Securing the Border for Public Health Act. And I thank the chairwoman for including it in today's markup. I also thank my colleagues on and off this committee for their support. I'm from a border state. The open border and the fentanyl flooding across our open border are killing my constituents and are killing your constituents. This bill expands current Title 42 authority to allow for the Secretary of the Department of Homeland Health and Human Services, after consultation with Attorney General, to restrict migration and imports from foreign countries to prevent the flow of illicit drugs, including fentanyl, into the United States. We have a crisis at our southern border, and it has led to the illicit drug crisis in all 50 states. In the last 2 years, our southern border has become more porous than ever before, allowing almost free flow of illegal drugs, weapons, and people. Drug cartels are being further enriched. Innocent people are dying. Fentanyl and other illicit drugs are pervading our nation, and U.S. Customs and Border Protection and local border law enforcement agencies are being overwhelmed with little support from the upper echelons of our government. This administration has willfully refused to maintain operational control of the border, violating the Secure Fence Act of 2006. This administration has undone and rejected many proposals that would address the security and humanitarian and drug crisis at the border, which in turn would help to address the illicit drug crisis that is killing Americans. Unfortunately, Title 42 has become one of our last lines of defense at the border. Just since October 2022, Customs and Border Patrol expelled 351,099 individuals under Title 42 authority who posed a health risk. Although the COVID-19 pandemic is over, the illicit drug problem is not, and it continues to be a public health issue. It has worsened in tandem with the increase in illegal border crossings. We heard from Brandon Judd, the National Border Patrol Counsel, at the field hearing in February. Quote, he said, "The Border Patrol alone, not the Office of Field Operations responsible for our ports of entry, seized 949 pounds of fentanyl along the southwest border from February 2021, the first full month of President Biden's open border policies, through January of 2022. CBP just recently released narcotics seizure data for President Biden's second full year in office, February 2022 through January 2023, and the amount of illicit fentanyl seized by just the Border Patrol has more than doubled to 2,294 pounds. To give some perspective on those statistics, 2,295 pounds of fentanyl converts to over 1 billion milligrams, enough to kill over 500 million people. That's more than the population of the United States. The CDC estimates that over 106,000 Americans died from drug overdoses in 2021. This committee has heard from several parents who have tragically lost children to fentanyl overdoses. To deny that this drug crisis is related to our unsecure southern border is unrealistic and dishonest. Even this administration acknowledges that fentanyl is smuggled into the U.S. through the southern border, and yet it continues to implement open border policies that make it impossible to stop the flow of illicit fentanyl and other deadly drugs. H.R. 801 is not a silver bullet for solving the illicit drug crisis, nor is it the only solution needed to address our border issues. But with this administration's refusal to enforce our current laws to protect our border, it is an important step to reducing the flow of fentanyl and deadly drugs into our nation. I urge my colleagues to support my bill, and I yield back.
Gentlelady yields back for the discussion on the bill. Ranking members recognized for 5 minutes on the underlying bill.
Thank you, Madam Chair. I want to speak in opposition to H.R. 801. There are a lot of detrimental effects from this bill, and it also concerns me that Republicans are vastly expanding the role of the executive branch. If that caters to their immigration agenda, I don't think they should be doing it in a way that so expands the executive branch without Congress having a role or having the significant role. When we were at the Health Subcommittee markup, I noted that this bill never had a hearing and it moved straight to markup, so neither the committee nor the public have had sufficient opportunity to fully understand how overreaching this policy could be. We continue to hear this conflation from the majority that the only way to prevent the spread of illicit drugs, or a major way to do that, is to lock down our borders. But my problem with this is that it prevents people with legitimate asylum concerns, right? Victims of rape and of violence, for example, from presenting themselves at the border crossing and staying in the U.S. while they await a hearing. They're forced to stay in Mexico or even the country of origin where that violence or persecution occurred. That's what's been happening with Title 42 during the COVID crisis, but we know that's going to hopefully end soon. And now they're saying, well, that may be, but now we're going to use this for the same reason because of fentanyl. But, I think that if the majority's interest is solving our nation's fentanyl crisis, they can better control the entry of illicit substances in the United States without these dire consequences for legitimate asylum seekers. I don't think this bill is an answer, and I think it corrupts the intention of Title 42 under the guise of drug control. Under current law, the federal government can suspend the right to introduce persons or property into the United States if there's a serious danger of the introduction of communicable disease. And while this law has been used by both the Trump and Biden administrations to respond to COVID-19, this authority should not be used to unfairly and inhumanly block entry for those seeking asylum and refuge in the United States. These people then are forced to stay in Mexico or the other countries, and they continue to be subject to inhumane treatment or persecution. So the bill would permit the Secretary to close our nation's borders to entrance of any country that an administration may choose based on an overbroad and vague determination that there is a, quote, a serious danger of a controlled substance entering the United States from that country. This is a vast expansion of the executive immigration powers and completely rewrites Title 42 authorities to expand the ability of the government to deny the entry of persons or person to the United States. It would permit the Secretary to make a nearly unilateral determination that people from certain countries must be denied entry into the United States, including individuals with valid visas and even legal permanent residence. It also appears that under this bill, the Secretary could shut down legal ports of entry from such countries as he or she determines are a serious danger, potentially blocking entry of all hosts of goods into the United States. And that could cripple our trading capabilities, our international supply chain, and provide the Secretary with broad authorities that could easily be misused to not only set immigration policy, but also global trade policy as well. So in any of the circumstances, I would imagine that my Republicans would stand in strong opposition to what's an unchecked power of the executive, but it appears that they're willing to relinquish important congressional authority because of their immigration agenda. I think our law enforcement agencies are best positioned to detect and divert controlled substances. This is not the role of HHS, CDC, or other public health agencies. Neither, in my opinion, is it the role of our health agencies to enforce or make immigration policy. For all these reasons, I strongly oppose the bill and urge my colleagues to oppose it as well. And I yield back, Madam Chair.
Further discussion on the bill?
Madam Chair.
Mr. Crenshaw is recognized for 5 minutes.
Thank you, Madam Chair.
Strike the last word.
I move to strike the last word.
Gentleman's recognized.
In response to the ranking member's comments, I think they're over. I think the concerns might be overblown. I don't think just as Title 42 is used now, it does not supersede basic asylum law. It is a tool used to expedite removal of people who should be removed anyway. And this simply widens the scope of who might fall under that. I think it is obvious that fentanyl is a public health hazard. And as to the issue of whether people who are truly deserving of asylum can no longer access the United States and our asylum process, well, I would say that's already the case because of how many people are flooding our border. What's actually happening is that economic migrants, who really have no asylum case whatsoever, and by the way, fleeing violence is not an asylum case. You must be persecuted. There's strict standards for what asylum actually is. A bad situation is not asylum. Where else would that apply around the world? So what happens now is economic migrants flood the system, and true asylum seekers with real cases can't actually get into the system. If you actually look at the statistics of, say, Northern Triangle countries, only 13% have been granted, when the final court case is done, 13% get granted asylum. That's because the rest of them are simply economic migrants. It doesn't make them bad people, but they're economic migrants if we're just being honest. And so because of that mass influx, the real asylum seekers can't get a hearing. They can't get in line. They're stuck in limbo forever. And what about the people who don't have the geographical benefit of being able to walk across our border around the world? What about them? Our system can't possibly handle all the people around the world that have true asylum cases because of the people who opportunistically just walk across our southern border. We're attempting to get a hold of this because that's the actual compassionate thing to do, both for our own citizens who are being poisoned by fentanyl, but also for people around the world who deserve asylum and are actually eligible for our true asylum process. I think that's how we should think about this in truly compassionate terms, and I yield back. Or perhaps I yield, well, I'll yield to Burgess. I will yield to the gentleman from Texas.
And I thank the gentleman for yielding, and I thank him for yielding. I thank him for his very wise comments on this. I want to take a moment and ask unanimous consent to introduce an article into the record. This is from this morning's Dallas Morning News, and it details how a suburban house was raided. They found 13 spiral notebooks, 16 cell phones, and it broke open a major case. The perpetrators who were selling fentanyl in our schools in North Texas, and we just had 3 deaths in the city of Carrollton, these folks are now in a heavily fortified farm in Mexico with the Sinaloa cartel. This is the problem. And this is what, I know our committee has got entirely the jurisdiction, but we can control the fentanyl, and we must. So it's very important that we pass this bill, but we also need to keep our eye on the ball on all of the other aspects of this treacherous poison that is coming into our country. And I would ask unanimous consent to put this on the record. I yield back to the
Without
gentleman from
objection, so
Texas.
ordered.
Boy, there's so many options. Well, Marion, I'll yield to the gentlelady from Iowa.
Thank you, Representative Crenshaw. Thank you, Madam Chair. I urge my colleagues to support H.R. 801, which I'm proud to lead with Congresswoman Lesko. This legislation authorizes the Secretary under Title 42 to prohibit individuals or property from entering our country from designated countries due to the public health risk posed by the exorbitant amount of illicit drugs crossing our border. While the COVID-19 pandemic is over, we are experiencing a deadly illicit drug crisis that pervades our nation, largely through the southern border, but not only from the southern border, as we've heard just the past week, with drugs coming across and record numbers coming across the Canadian border as well. The CDC estimates that over 107,000 Americans died from drug overdoses between August 2021 and August 2022, 70,000 of which resulted from fentanyl or its analogs. Because my time is running out, let me just say, as a former director of the Department of Public Health, the CDC has repeatedly called the fentanyl crisis an epidemic. They choose their words carefully. They've cited the record number of drug overdoses that's more than quintupled in the last 24 years. This comprises vast increases in opioid and synthetic opioid-involved deaths, which is also highlighted by news outlets such as the Washington Post and Fox News. It's not a manufactured crisis. This is real. A gentleman in the audience is here to show you that it's real, and I'm proud the Republican majority is committed to passing meaningful legislation to combat it. I urge my colleagues to vote yes, and I yield back the balance of Representative Crenshaw's time to him.
I yield back. I'm done choosing favorites.
Gentleman yields back. Is there further discussion on the bill? Mr. Reese is recognized for 5 minutes to strike the last word.
Thank you. We must act on fentanyl. This is an epidemic. This is a serious problem, but this bill harms asylum seekers by inhibiting them from even exercising their American law rights to seek asylum, and it harms those fleeing persecution and doesn't solve the problem. You see, this bill would dramatically expand the Trump-initiated Title 42 policy to give HHS Secretary the authority to prohibit people and goods from entering the U.S. Supporters of this bill claim that this will prevent illegal drugs from coming across the border. However, this bill is simply wrong. It's the wrong approach. As an emergency physician, I have seen time and time again the devastating and often fatal effects of drug overdose. Fentanyl, in particular, continues to wreak havoc on our communities. I also represent a border district, and illegal drugs crossing the border is a very real concern for me and my constituents. Congress shouldn't double down on Title 42. We need to move past it. It was never a way to manage the border. It denied individuals their legal right to seek asylum and hurt those fleeing persecution and violence. It goes counter to international humanitarian norms and values. Every person fleeing for their life, whether from a Russian dictator or a drug cartel, deserves to have their legal right to due process and their cases heard for asylum protections. I support the Biden administration decision to end Title 42. We have vaccines, effective testing, quarantining protocols now in place. I'm also concerned that this bill ties our nation's drug policy to our nation's immigration policy, two issues that are not meaningfully connected. You see, there is a Cato report study that shows that the vast majority of fentanyl are brought by U.S. citizens, bought by U.S. citizens, used by U.S. citizens through the ports of entry. So in reality, fentanyl smuggling is overwhelmingly done by U.S. citizens through the port of entry. But they don't want to discuss this. They don't want to accept this. For example, in this same report in 2021, 10 times more U.S. citizens were convicted of fentanyl smuggling than undocumented immigrants. That's for every 10 immigrant smuggling fentanyl, there were 100 Americans smuggling fentanyl. So we shouldn't confuse these two issues. So you see, extending Title 42 will do nothing to stop U.S. citizens from carrying, smuggling fentanyl through ports of entry with U.S. citizens consuming fentanyl, going to the emergency departments with an overdose and dying from fentanyl overdose. We should work together in a bipartisan way to build a professional and humane immigration system by passing comprehensive immigration reform, focusing on real border management policies, and getting CBP the resources they need to do their job. So I oppose this bill because it will do nothing but vilify and the asylum seekers and urge everyone to do the same. And I yield some time to Tony Cardenas.
Thank you, Doctor. I agree with everything that you just said. That was accurately said and truthfully said about what the real issues are. So therefore, I oppose this misguided legislation. I cannot sit here and not mention the most egregious participants and the creators of the fentanyl crisis that we have today, and that is the American family, the Sacklers family, who out of greed manipulated this entire situation to the point where we have a fentanyl crisis that this country has never seen before. Not immigrants, American citizens have put us right here where we're at, where every single member of this committee, every single member of the House of Representatives has deaths in their district resulting from fentanyl overdoses. It was created by American greed and was created right here in our country. And the motion before us is nothing more than just an opportunity to make it seem like somebody else is the evildoer. Yes, there are many issues. Yes, some issues are coming across the border, but let me be clear. As was just mentioned by my colleague, Dr. Rees, most of the fentanyl crossing our border is being done by American citizens, not people who look like me. People who look just like the Sacklers. People whose hearts are just like theirs. Careless, greedy, and have no love for the American people. And I'm sure everybody on this committee has much love for the American people, but this is not the answer, and I yield back.
Madam Chair, if I can ask for unanimous consent to insert the Cato report into the record for this discussion.
Without objection, so ordered.
Thank you.
Gentleman's time has expired. Is there further discussion on the bill?
Not on the bill. I have
Gentlemen.
a point of personal privilege.
Okay, gentlemen,
Let me go
Mr. Bilirakis is recognized for a point of personal privilege.
Thank you, Madam Chair. I know this is a very important bill, so I'll be very brief. I want to recognize a good friend of mine and a great American human rights activist around the world, religious freedom activist, just a great American who loves children. And he does these basketball clinics around the world at no charge for our children. So we appreciate you very much. Again, Ines Cantor Freedom. Please stand, sir, to be recognized. We appreciate you so very much. I want to yield briefly to Representative
Would you
Kluger.
yield? Well, I just want to say, if you yield back
Please,
to me.
I'll yield back, yes.
Yield to the chair. And he got his TikTok account reinstated yesterday.
That's right.
I'll yield back. Okay.
Briefly yield to Representative Kluger.
Thank you. And thank you for your courage, Inez. Thank you for your leadership in all of the things that you're doing. I can't say it any better than Mr. Bilirakis, but you really have led on issues that have exposed the Chinese Communist Party, the atrocities, the human rights violations, the genocide that is going on. We appreciate you. We recognize you. And within 5 minutes yesterday of talking about your account, it magically reappeared. I yield back.
I yield back.
Yield to Buddy, please.
Yes, please. I yield
Oh,
to.
it's point person. Okay,
Okay.
yield back to me. Sorry. Yes, I didn't give time because that was a point of personal privilege. Okay. I yield to Buddy, Mr. Carter, for 5 minutes. Recognize the 5 minutes to speak on the bill.
Thank you, Madam Chair. Madam Chair, I just want to respond to my colleague across the aisle who made the comment that most of the fentanyl coming into this country is coming through the point of entry. If you will remember, we had a field hearing in Texas, in McAllen, just a few weeks ago. And we were told by Customs and Border Patrol that only 5 to 10% of the fentanyl coming into this country is coming through the port of entry. That only 5 to 10%. And the other side of the aisle made the observation that 97% of all the fentanyl coming through the point of entry is captured. So that begs the question, I don't care if it's 100%. So 100% of the 10% that's coming through the port of entry, we're getting, but where's the rest of it coming from?
You're saying.
And how do we know whether it's American citizens or whether it's not American citizens? And what does it matter? What, you want to tell a grieving father that, oh, it was an American citizen brought fentanyl in? No. And let us not forget where the active ingredients that are making these products are coming from. Over 160,000 manufacturing plants in China. Only 3,000 in the United States. You're right, my colleague is correct in the sense that we need to address this. But by doing this, by saying that it's coming through the points of entry, that's erroneous. That is not what we were told at our field hearing only a few weeks ago in McAllen, Texas. We were told that the majority of it is coming across the border and not at the points of entry. So I just want to make sure we understand and we've got the correct information here.
Yeah.
And I want to yield to Mr. Pfluger from Texas.
Will the gentleman yield?
I yield to Mr. Pfluger from Texas.
Thank you. You know, we did have a hearing, and I want to speak as the subcommittee chair for Intelligence, Counterterrorism, and Law Enforcement on Homeland Security. Fentanyl knows no boundaries. It doesn't know ethnic boundaries. It doesn't know religion. It doesn't know where you came from. When you are poisoned by fentanyl, it is extremely deadly. We agree on this issue that we have a problem with fentanyl. We had a hearing yesterday, a bipartisan hearing, to push back on the CCP's influence using ByteDance's subsidiary TikTok. 90% of the precursors are coming from China. Why are we not coming together on this issue to push back? Title 42, I agree with my colleague, Mr. Ruiz, that this is not the solution. It's not. But Title 42 is the only tool that we have right this second to push back. It is the only tool to stop the madness. And when you go down to McAllen and Del Rio and Eagle Pass and El Paso and anywhere else, you hear from the Border Patrol agents, you hear from Customs. And by the way, Chief Raul Ortiz last week in a field hearing in McAllen, where this committee also convened, said, and I quote, 5 of the 9 sectors along the southwest border are not secure. He said that. How can we say that fentanyl is coming across and that it's just legally coming across? It's not. It is not legally coming across. It's being trafficked by cartels. I yield back to Mr. Carter.
I yield to Ms. Lesko.
Thank you. A couple things have been said that I want to refute. First of all, Mr. Pallone said, well, he's against this bill because it would expand executive authority. The Secretary of Homeland Security already has authority to close the border. And so it's not being done. The laws aren't being followed. Somebody else said it prevents people with legitimate asylum claims from being able to stay in the U.S. I think Mr. Crenshaw had a really great answer. No, what it's doing is there's so many people flooding that do not have legitimate claims for asylum that it is, forcing out the people that actually do have a legitimate claims. And this bill does not supersede asylum laws. The last was about, all of the drugs are coming through the ports of entry. As was stated, that's just absolutely not true. And in fact, in the Tucson sector, the highest drug trafficking sector in the country, they said more fentanyl interdiction is between the ports of entry than at the ports of entry. And with that, I yield back.
Okay. Madam Chair, I yield back.
Gentleman yields back. Does anyone else seek to be recognized on the bill? Ms. Eshoo is recognized for 5 minutes.
Thank you, Madam Chairwoman. I move to strike the last word. I'll be brief. I've paid close attention to what members on both sides of the aisle have expressed, And there are two things that stand out to me. As members have been expressing their views, it really calls out that this should have been taken up at the Health Subcommittee. And I'm surprised that that has been skipped over. The debate on many points that are being raised today, they're being raised for the first time. And the scrutiny of the subcommittee for both sides of the aisle is invaluable, really. And I think that we are feeling the results of that lack of scrutiny. The other point that I want to make is that this bill vastly expands Title 42 for reasons that have nothing to do with communicable diseases. To be frank, I don't want the Secretary of HHS making our drug enforcement, trade, or immigration decisions unilaterally. And I'm surprised that the Republicans are in support of this vast expansion in the executive branch. It's not well thought out. We know that the fentanyl crisis is a real crisis, but we can't address it using the same tools that we used for COVID-19. So those are my objections, Madam Chairwoman, and I find it regrettable that it didn't come through a really healthy discussion and debate at the subcommittee. I think we would have been better off and not trying to hash out what is the work of the subcommittee in the full committee. So with that, the gentleman from my colleague from California, I'll yield the balance of my time to.
Thank you. I'd just like to clarify. I went to the field hearing in Texas along the border, and I just want to clarify for the record. Yes, we did hear from some folks who were giving us their opinion, and I'm not negating their opinion. I'm not negating the truth as they see it or experience it along the border, but I would much rather go with a study like which was referenced by Dr. Rees, the Cato study, than make policy based on references and anecdotal references, truthful to the individuals who are giving those anecdotal references, but that is not, in my opinion, where we should be making policy on. Thank you.
Thank you. And let me clarify how this policy prevents asylum seekers from seeking asylum. Our American laws grant individuals who step foot on United States soil to seek and claim asylum to due process. Title 42 prevents them from being able to enter the United States, even if they're seeking asylum, because they use Title 42 and they say you have to stay in Mexico or wherever, and therefore they do not have the ability to claim asylum based on our American law. So yes, indeed, this Title 42 prevents asylum seekers from stepping foot in American soil to then exercise their American law right to seek asylum. I yield back to Anna Eshoo.
Will you yield?
There's another.
Yes, please. Yeah.
My remaining time to Ms. Craig.
Thank you. Just a quick point of clarification. I really enjoyed being at the border with my colleagues across the aisle. I do think Mr. Carter, his facts as quoted are a little bit wrong. I think I was the one asking the question at the field hearing. And I believe what Customs and Border Patrol told us is that, sadly, only 5 to 10% of the fentanyl coming into America is being seized at the border, but that over 80% seized at the border is coming through our ports of entry. Less than 5% of the fentanyl seized at the border, as I recall, seems to be seized from individuals, and we have a report that we'll put into the record on that. But that, I believe, just Mr. Carter was incorrect in the quoting.
Time has expired. Recognized for 5 minutes to speak on the bill.
Thank you. I was compelled to speak given the back and forth and some of the inaccurate information out there. So I wanted to, as somebody who in the last Congress was the chair of the border subcommittee, and we had multiple hearings on the topic, I think we all agree that fentanyl is a problem and an issue. And it would be better if we worked together to try to address it. But what happens is this becomes about immigrants and immigration, and then it's like painting the broad stroke pictures of who's bringing it in and how terrible the people are, and then generally that's an attack on immigrants. But when it pertains to fentanyl, seizures in fentanyl at the ports of entry began to rise under the Trump administration. For example, U.S. Customs and Border Protection reported a nearly 200% increase in seizures of fentanyl at ports of entry along the southwest border in June of 2020. Under President Biden's leadership, DHS has continued to make significant progress in preventing drugs from entering our communities. DHS has seized record amounts of fentanyl over the past year and provided more than 30,000 pounds of this deadly drugs from entering our countries. And where is it happening? At the ports of entry. 96% of fentanyl seizures are occurring at the ports of entry. The other point I want to make is Democrats, House Democrats, last year in the omnibus bill, put dollars in there, something our colleagues across the aisle did not vote to support, but Democrats funded additional staffing for CBP ports of entry in the 2023 omnibus to address historic understaffing, prioritizing drug detection, and funded $70 million in non-intrusive inspection systems at the southwest land border in fiscal year 2023. Right? We got to continue to invest in technology that's going to stop the drugs from coming. We all have seen the photos. It's the photos of cars, and they take pieces out and they put them onto the side. And these are not folks that are coming that are undocumented. These are generally, as was said, folks that are citizens. Now, at the end of the day, I think the starting point is trying to at least come to an agreement on where the majority of this is coming from so that we could address it to stop it. Now, I took great offense to, unfortunately, the comment that was made that there's people opportunistic just walking across the southern border. There are people that are fleeing violence. They're fleeing torture. Some of their children have been killed in other countries. They're not just leaving their family and their belongings and making a dangerous journey because they want to come and just walk across the southern border. And some of them are traveling for weeks and days and months. Some of them don't even make it to the southern border, but they do it out of desperation because they want the opportunity to be able to live. Now, I happen to have represented a woman and a child from Guatemala. They had already killed one of her kids. And so she came to the U.S., and it is so hard to get asylum that even she didn't qualify for asylum without having all the resources. But that's not all there is. There's something called withholding of removal. There are other things other than just asylum that allow folks to be able to come and stay here legally. And so it's just disturbing to kind of characterize folks that are coming here are people who are opportunistic, that there's not recognizing what people are going through and why they make this journey. There are other grounds that may not just be the fear of persecution. It could be that they could be tortured returning back, or there is significant evidence to do so. And so to just try to use another legislative vehicle and say like, oh, well, let's just allow the Secretary of HHS to just shut down the border, that's just not how we should be doing policy. We should be coming together, we should talk about, and we should continue to work toward comprehensive immigration reform. That's going to be the first step in this. But it's also going to be in putting the resources and the dollars at the southern border that are going to go into ports of entry where most of this is coming. And so with that, I yield back.
Is there further discussion on the bill? Mr. Armstrong is recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word.
Gentleman's recognized to strike the last word for 5 minutes.
A whole bunch of things can be true at once. You can seize more fentanyl at the border, port of entry, between ports of entry, U.S. citizen, not U.S. citizen, however you want to deal with it, and there's still more fentanyl in Grand Forks, North Dakota. The reason you're seeing record seizures is because you're seeing record numbers of pills being made and pills being trafficked. No one has ever yet been able to tell me two different things. One, we know we're seizing more. Do we know if we're seizing a higher percentage of it? Because they can't answer that question. And two, the simple reason for more ports of entry and non-ports of entry is because of the resources and the ability to deal with that and the operational control of the actual border. But I think more importantly, and for this conversation, here's two things that are absolutely true. The drugs, all of them, are being made by the cartels. All of them. At this point in time, the fentanyl pills that are in your community have an origination with a cartel. And if not all, almost every single person seeking immigration legally or illegally to get to the northern border in Mexico also is dealing with the cartels. 100%. So if you are a backpack full of fentanyl pills to get to the southern border, you're dealing with the cartels. If you're a 12-year-old girl seeking refuge and asylum in the United States, you are dealing with the cartels. Those two things are true. Ports of entry, non-ports of entry, U.S. citizen, not all of this. The absolute fact of the matter is to get to the southern border right now, you are dealing with the cartels. And if this stops that and this helps that, then we should support it. Because I will tell you one thing, I don't think the cartels have a very good track record when it comes to human rights. Do you want time? Sure, I'll yield some time to my friend Dan Crenshaw.
I thank the gentleman, and I want to echo his comments. It was really well stated, and just say how kind of strange the discussion has been. We keep hearing that this is not the way to solve it. Well, we also have other bills that we've promoted to try and solve this problem. You don't want to make it a Schedule I crime. You don't want to go after the dealers. You don't want to go after the cartels. We agree this isn't the only way to solve the fentanyl crisis, but it is one of many measures. And if you reduce the overall crossings, which Title 42 helps us to do, it's a disincentive. It does not discourage asylum seekers. That is not superseding asylum. And yes, and I'm sorry it's offensive to say that some people just want opportunity here and that's the only reason they're coming, but it's just the truth. We all know it. Most of the people coming, I'm sure, are nice people, but they're coming for just opportunities. It's better here. If you did a poll around the world to see how many people would just instantly transport themselves to the United States, you'd get about 40 million people here instantly. That's just by Pew Research data. And so America has to have some kind of system and some kind of standards by which we allow people in. That's just how we have to do it. It's just general rule of law. We're not trying to do anything crazy here. We're not saying this is the one silver bullet, but it certainly is helpful, and it's not crazy to say that a fentanyl epidemic, as the CDC defines it, is similar to, say, a COVID pandemic. It's not a crazy thing to say. We do want legitimate asylum seekers, and most of all, we want our system to be able to deal with legitimate asylum seekers and not be overrun by illegitimate asylum seekers who are just trying to game the system and literally given cards on how to game the system by the cartels. Because yes, my colleague is correct that every single person does have to go through the cartels. They have operational control of that southern border. And that's a very disturbing fact, and I would like everyone to rally around at least targeting the cartels and what they do to our country. I hope we have other bills that are outside the jurisdiction of this committee that I think we could all get on, I would hope. And I yield back to my colleague from North Dakota.
Madam Chair.
Mr. Armstrong controls the time.
You yield.
You yield?
Yeah, I move to strike the last word.
Okay, gentleman yields back. Mr. Armstrong yields back. Further discussion on the bill. Gentleman from Florida, Mr. Soto, is recognized for 5 minutes to strike the last word.
Thank you, Madam Chair. Just want to bring up 3 key points. One, under the Infrastructure and Jobs Act, we provided $3.6 billion to modernize border stations and land ports of entry, including $2.53 billion for carrying out the CBP's 5-year plan. These advanced sensors are the strongest weapon we have at the border to stop fentanyl because the pills are so easy to hide. Without electronic surveillance, you simply can't do it in an efficient way. I got to go down to the border on a bipartisan trip with my dear friend, Representative Tony Gonzalez, and we met with CBP officers. They also believe the sensor towers that are able to monitor over 3 miles are highly effective, and we can have bipartisan solutions to fund more of those sensor towers to create more border awareness. The second point is President Biden had asked for $4.9 billion for his 2023 budget for border security, and as reported by the Washington Post, he was blocked by Senate Republicans in December and ultimately got only $2.7 billion in increased border security in this last omnibus. The third thing, we have Biden's new parole program, and it was reported on March 15th in the Washington Post that unlawful crossings for migrants from those 4 countries, Cuba, Venezuela, Haiti, and Nicaragua, who are 4 of the countries that we saw most of the border crossings from, went from 84,000 down to 2,000 from December to February. And I agree, we should be a little more aggressive with the cartels. They are a terrorist threat to our nation. And so there are things we can agree on and do together, right? I think a lot of the work that needs to be done in the budget, we need more bipartisan support for, and we should rally behind the president's request for additional funding for border security and for sensors to really get at this going forward. It takes resources. Thanks, and I yield back.
Gentleman yields back. Does anyone? Gentleman from Texas, Mr. Weber, is recognized for 5 minutes to speak on the bill.
Thank you, Madam Chair. When I was in the Texas legislature, I spent 4 years on the Texas Public Education Committee, 2 years as the vice chair of the Borders Committee. And while our heart goes out to those who live in countries that don't have the same opportunity that we have, it's very sad. You hate that. But here's a little math just from the Texas point of view. There's about, I'm going to use round figures, there's about 1,000 school districts in Texas, and there's about 5.5 million students, again, kindergarten through 12. There's a lot of fentanyl deaths happening to our students right now, unnecessarily so. We ought to be on top of this. But let me give you some other math about it, too. When you bring in so the average school district, if you use those figures, let's say 5 million divided by 1,000, the average school district would be 5,000 students. Now, most of y'all probably know that in Texas, of the 254 counties, there are some that have more cattle than they have people. So 5,000 is a small number, but Texas is a big state, for school district, K through 12. When you brought in 70,000 unaccompanied minors summer before last, I think it was, it's a lot higher number than that now. You just brought in 14 complete school districts. Somebody has to pay to educate and teach. Guess who that somebody is? It's those Americans, hardworking Americans who are already here legally. Your heart goes out to them. But America cannot afford to be the charity for the world. It's costing us fentanyl lives and fentanyl while the border's open. It's costing us economically. It's costing border agents their lives. I think at last count there was 17 who had committed suicide. Fentanyl is something that we can and must address if we want to protect the existing students in our schools. And then we ought to have that conversation about, do we really want to have so many students coming in that we have to pay to educate them? This is a good bill. This is one step in the right direction. I speak from experience. In 2010, my second session there, 2011, there was 5,000 Texans, just in the state of Texas, who were either raped, pistol whipped, burglarized, car stolen, some of them killed, people murdered, homes broken into, businesses broken into by illegals who weren't even supposed to be in Texas. We've got to get a handle on this border situation. And the first thing we can do with this committee, with this bill that we're discussing today, is we can begin to get a handle on the fentanyl crisis. I shudder to think how many Texans today are being violated by the cartel-induced and controlled traffickers that are coming across the border. 1,960-something miles, America, United States and Mexican border, and Texas has about 1,100-something, almost two-thirds. Texas is paying one heck of a price. This is a step in the right direction. We can start protecting Texans and Americans. And with that, Madam Chair, I'll yield back.
Gentleman yields back. Is there further discussion? Seeing none. The question now occurs on approving H.R. 801 as amended. A recorded vote has been requested. The clerk will call the roll.
Rogers.
Aye.
Rogers votes aye. Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon. Hudson. Wahlberg. Carter. Duncan. Carter votes aye.
Would members wait just one more minute?
Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Fluger. Fluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone.
No.
Pallone votes no. Eschew. Eschew votes no. DeGette. DeGette votes no. Schakowsky. Matsui. Matsui votes no. Castor. Sarbanes. Sarbanes votes no. Tonko. Tonko votes no. Clark. Clark votes no. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Peters. Dingell. Dingell votes no. Veazey. Veazey votes no. Custer. Custer votes no. Kelly. Badagan. Badagan votes no. Blunt Rochester. Blunt Rochester votes no. Soto. Soto votes no. Craig. Craig votes no. Schreier. Schreier votes no. Trahan. Trahan votes no. Fletcher. Fletcher votes no.
Are there any members not recorded? While the clerk is counting, I just wanted to say a quick note about Kristen CM, who will have her last day on the Energy and Commerce Committee. She came to us from Morgan Griffith's office, Morgan, back in 2019, and she served for 5 years on the Energy and Commerce Committee. She helped us a ton during the pandemic when members were trying all hands on deck to respond and try to get supplies and connections. And then she also was very helpful, led on the FDA reauthorization bill last year, many of the provisions that we got included in the omnibus at the end of 2022. And doing that all while just being a great member of the team and starting her family. She gave birth last August to Della, and she's going to be moving on. And I wanted to say thank you for all of your great leadership and work on the committee. So please join me in thanking Kristen CM. All right. Clerk will report.
Madam Chair, on that vote, we have 24 ayes and 19 nays.
The ayes have it and the bill is adopted. Without objection, staff is authorized to make technical and conforming changes to the legislation approved by the committee today. So ordered. Without objection, the committee stands adjourned.